Good morning dear students. Let's discuss now about part 3 of complaints in the 4th unit. It has recalling and waste disposal to discuss now. What are the contents we are going to discuss now? Recalling and waste disposal in pharmaceutical industries. What is a product recall? A firm's removal or correction of a marketed product that FDA considers to be in violation of the laws it administers, against which the agency would initiate legal action. What is a product recall? A firm's removal or correction of a marketed product that FDA considers to be in violation of the laws it administers, against which the agency would initiate legal action. Let's see what are the goals of a product recall. It is to protect the health of public. It is to protect the health of public and to inform the public about the hazardous product so that they do not eat it. To inform the public about the hazardous product so that they do not eat it, and to regain the control of all hazardous products. To regain the control of all hazardous products. Next to the goals of a product recall, the classification scheme of a product recall comes now. Recalling process has 3 classes: class 1, class 2 and class 3 recall. What is class 1 recall? A situation in which there is a reasonable probability that use of or exposure to a violent product will cause serious adverse health consequences or death. So what is a class 1 recall? A situation in which there is a reasonable probability that use of or exposure to a violent product will cause serious adverse health consequences or death. So this is coming under class 1 recall. What is class 2 recall? A situation in which use of or exposure to a violent product may cause temporary or medically reversible adverse health consequences, where the probability of serious adverse health consequences is remote. Coming to class 3 recall, it is a situation in which there is a reasonable probability that use of or exposure to a violent product will not likely to cause adverse health consequences. It will not likely to cause adverse health consequences. Coming to the responsibility of recalling process. It is responsible by production head, quality assurance head and unit head of pharmaceutical industry. Who has to take responsibility? Production, quality assurance and unit heads. What are the primary reasons for a product recall? A product recall may be mandated by a regulatory agency as a result of a violation of a government act, standard or other mandatory regulations. A product recall is required to avoid potentially serious additional product liability claims or losses. Then it is indicated by the analysis of field monitoring reports and feedback that may point to product tampering, near-miss incidents, accidents or consumer complaints. Then a product recall should be suggested by new information based on additional research and product testing. Then it may be needed when characteristics of the product don't measure up to the advertised claims for safety and effectiveness. So these are the primary reasons for a product recall. Coming to product recall procedure. First, determine the degree of recall. Degree of recall comprises of 3 degrees 1, 2 and 3, where degree 1 has product with high health risk and it requires freezing of stock within 24 hours, where degree 2 has product with minor health risk or substandard. It requires freezing of the stock within 72 hours, where degree 3 has product with other reason for recall. The next step in product recall procedure is disseminate recall instructions. It is to disseminate recall instructions. It has 3 concepts: freeze, establish, organize. What you will freeze? Freeze the internal stock of the product. What you will establish? Establish the record and report of recalled product. What you will organize? Organize the return of the recalled product. Next to recall procedures, let's discuss about what are recall triggers. Recall triggers are customer complaints, GMP deviations, results of a failure investigation, result from the QC stability program, information from the regulatory authorities, result of an inspection, known counterfeiting or tampering with the product, adverse drug reactions. So these are the recall triggers. Coming to waste disposal, what are known as pharmaceutical waste? The pharmaceutical wastes are potentially generated through a wide variety of activities in the healthcare system, including syringes, and are not limited to intravenous for preparation. What all the things will come under pharmaceutical waste? They are expired drugs, patients' discarded personal medications, waste materials containing excess drugs like syringes, 4 bags, tubing, vials, etc. Waste materials containing chemotherapy drug residues, open containers of drugs that cannot be used, containers that held acute hazardous waste drugs, drugs that are discarded, contaminated garments, absorbents, and spill cleanup materials. So these all the things will come under pharmaceutical waste. How pharmaceutical wastes are classified? There are 3 classifications of pharmaceutical waste. First one is hazardous waste, second one is non-hazardous waste, and the third one is chemo waste. Hazardous, non-hazardous and chemo waste. Let's see the tools for pharmaceutical waste management and disposal as stated in the India's pharmaceutical waste rules. The tools are incineration process, autoclaving, microwaving, chemical disinfection of waste, deep burial, secure landfilling of waste, then waste immobilization including encapsulation and inertization, at last sewer method. So these are all the tools or processes used for waste management and disposal as stated in the India's pharmaceutical waste rules. What are the waste management strategies? Waste minimization, reuse of waste, then recycling of waste or reprocessing of waste. So how we can manage waste, what are the strategies, minimization of waste, reuse of waste, and recycling or reprocessing of waste. Hope we have discussed thoroughly regarding various aspects under complaints in pharmaceutical industry, and today about recalling and waste disposal. With this, complaints part under unit 4 is getting over. In the next class we will be discussing about document maintenance in pharmaceutical industry. Thank you all for patient listening.